I can't overemphasize collecting data from the beginning, because over and over and over again, when we've done research projects with specialty courts, mental health courts, or other types of jail diversion programs, people tell us, well, this is how many cases we have annually, and this is what they look like. And then we design a research project around that, and then when we actually collect the information, it turns out they weren't right, that the impressions that they developed in the absence of data are wrong. And it really helps at the outset to collect basic data, descriptive data, not fancy data, descriptive data about who's coming in, where they come from, how long it takes you to do the evaluations, who gets accepted into the court, how many get accepted into the court, and to track them in terms of how long they stay under supervision, what are the mistakes that courts make to try and make themselves look good in many instances is they give you a whole bunch of information on the graduates. Well, what happened to all the people who were enrolled on the court and dropped out or were kicked out? And we need to know that that's the real picture of how well they do. And one of the things that I say to people is it's much easier to begin or get the first year funding, if you have funding, for a mental health court, than it is to get the second year or the third year. Because the first year you get funded on promises. On the second year you get funded on performance.
We try to keep the numbers small, and the theory behind that is we want to get all of the procedures and the processes worked out before we'll go full-blown. We can usually figure out when we do the needs assessment with the court what their caseload is and how many people they think would be going through the program in a year. So at the outset, we'll have a target number, but when we start, again, we will have the court start very slowly and just phase in different groups. I have some courts that will want to start with probation violations because you can immediately get those people in and you don't have to wait for new cases to come through. Other courts will just start with new cases, and as they trickle in, you slowly build capacity. We always tell courts the first year is really an evolution year for the program, and it's the time for them to really figure out if what we put on paper will work in practice, and that things will change during the course of that.
We've attempted throughout our mental health court to allow other agencies to assist us with our mental health court. A prime example would be our shelter, where when we have a person who's getting out of jail, contact them to make sure that we can have a bed available for them. We have our public defender, solicitor's office, who is present every day that we have court, and those are in-kind services. So we have a public defender who is able to go over every case, along with the solicitor's office. We have victim advocates from some of our Tri-County area who are also present, and those are in-kind services, and they attempt to assist if that person is coming from their area. Some other community resources would be our probation agents, and we have an individual who is present every day, who is at the table. And recently we have an advocate from the Veterans Affairs Office or hospital who is also there to assist us.
One of the things I think that's really happened with us, that we've been able to take community correction monies, which started out at $300,000, has grown to $8 million. We're able to get the Attorney General, who sues every pharmaceutical company, to donate some of his money, I think about $2.5 million, into our programs. We use offender fees, we use monies from suits, we use direct dollars from legislators, we use community dollars. You've got to be able to find outside dollars.
One thing that we've done over the last several years is we've built relationships with other agencies, is our relationship with DIODIS. And what that's allowed us to do is projects outside of mental health court, working on doing more integrated treatment and training. So we've done a lot of cross-training, done some other projects where somebody that has a dual co-occurring disorder can go to either agency at their front door and receive services there. So that helped break down some of the barriers between those agencies, and it's allowed us as mental health court providers to get the training we need to handle as much of the co-occurring disorders as we can in one spot. So that's nice. They've been able to help us learn some motivational interviewing, some developmental model of recovery kinds of things, which has been phenomenal.
I think we get the most out of our team by a couple things. Obviously, you need to avoid burnout, but I think the answer to how do you avoid burnout and get the most out of your team is the same, which is we try to keep everything current and we're continually trying to learn. So we do a lot of team meetings. We try to go to a lot of trainings. Even when money's tight, if someone goes to a training, we bring back that information. And what we've seen with a lot of teams is people go to a training, hear something, and it's great, and then they never change anything in their program. We try to continually, if we learn something, we try to implement it in our program. And I think that's energizing to people. I think that's exciting for people. The other thing we do with our team to try and keep them current is a lot of looking at our outcomes and finding ways to improve. So it's really fun for folks to actually look and say, this is what we're doing, how do we get better at it? We do a lot of that. And team meetings with food always helps.
I had the opportunity just to sit and watch. As I understood that I was going to be participating in a mental health court, before I ever did that, I was sitting through staffings, and I was watching that, and I was sitting through court sessions and watching that. And so it wasn't cold turkey. I was able to experience that and get my toes wet as I was watching those court sessions and watch the staffing and how the staff interacted and how the judge interacted with the staff and how the judge handled the court sessions. I've had a lot of questions, and so the staff has been able to answer a lot of questions. Again, I'm not a treatment provider, and so I ask questions about acronyms or phrases and terms that I'm not familiar with, and of course the staff is willing to answer those and educate me, and that was part of the process of just getting an education about mental health treatment in the program, what works, what doesn't work, what are the evidence-based practices and how those work. And so again, the staff was very helpful. As far as the procedure, again, I had a chance to look at that before I ever took over, before I ever presided over a session.
It's just really a good program, and I back it wholeheartedly. As soon as I haven't graduated, I'm in phase 3, and as soon as I graduate out of this program, I'm going to come back and volunteer to go through and help people coming into the program.
A tremendous amount of footwork on the ground, shaking hands, going out to lunch with people, selling the program, telling them about what they were seeing happening in the courtroom to these people and the changes in their lives. From the first graduation on, inviting anyone and everyone who we thought might be interested to come. And over the years, a lot of different folks in key positions come to congratulate your graduates and to learn about the problem. and to learn about the solution with mental health court. They've invited legislators, justices, the county commissioners. I mean, whoever you could get around the table. There's a lot of, just let me sit down and tell you about this program and how it works. If you want to sustain it, you have to let people know the successes that you are doing. And, of course, it helps as well to keep data and be able to show them, here's our percentage of recidivism, here's our percentage of success, this is the percentage of those that have dropped out, that type of thing. And in the beginning, we did a minimal amount of data, but on the key things that policymakers wanted to hear about. And so, I mean, it's really a combination of a lot of groundwork, a lot of foot soldier work with every agency and every political entity and every person in a position, local or circuit level or state level or federal, that we could potentially get financing from. And we didn't cross anything off the list, and we still don't. We still look at wherever we can to get that financing, because you can't just rely on the federal dollars. They do dry up.
We don't want to create such a wonderful system that people ever feel that they have to be arrested to get treatment. It's one of my greatest fears, is that we institutionalize the criminalization because people think you have to get arrested to get access to treatment. And so I think we have to be cognizant of that as we build this diversion system, this criminal justice system, trying to help people with mental illness. But it's doable. And, I think ultimately our goal should be to get out of the business. And so that we don't have this overrepresentation of people with mental illnesses, and we can go back and be regular judges. That should be our ultimate goal, not to create a new system that's kind of interesting and cool to be part of, but that accesses the outside system and ultimately help the community system work so well.